Hey, YouTube!
Welcome back to the AMP podcast. Today we will talk about our experiences with lower extremity injuries.
I'll start us off. I strained my hamstring during a meet in track and field during this past season. I was competing in the long jump and I went to jump and I strained it in midair.
That's a pretty cool story. What about you, Dante?
I actually also had a hamstring injury, but I pulled mine. It was during a baseball practice. We were doing a relay race at the end for fun, and I was running and just pulled.
Nice. I had an ankle injury during the cross-country season this past year. My ankle was swollen and I had to do a lot of muscle strength training, rehab, and to nurse it back to health. What about you, Justin?
It all started on that fateful day. Nice day. Good. Ah! My knee!
Damn, Justin, that looks like it really hurts. Here's your knee. You tore this right here, your meniscus.
Hey y'all, it's LeBron Raymond James. I'm Doc Goat. Shout out to Mrs. Christina Kowalski for letting me help out this group. Your group project is not about the meniscus. That is a ligament. You need to start researching about the muscles and their origin and insertion. I'm sure Justin is in a lot of pain, but that is not relevant right now. Let's go back to Brandon's and Dante's hamstring injuries. Matter of fact, I have an article that you can use for the knowledge of a hamstring injury. The article that I got for you guys is Eccentric Training for Prevention of Hamstring Injuries May Depend on Intervention Compliance, a systematic review and meta-analysis. This helps related to the topic of lower extremity injuries because it helps you try and prevent hamstring injuries from happening. A hamstring injury often happens during sudden, powerful movements, such as sprinting, lunging, or jumping that overstretch your tendons or muscles. Hamstring strains are the most prevalent muscle injuries reported in sports. These injuries alone have accounted for between 6% and 29% of all reported injuries in football. The hamstring muscles are not used much while standing or walking, but they're very active during activities that involve bending the knee. Just like when I dunked on Jason Terry in 2013, you should start doing gentle hamstring stretches after a few days when you sustain an injury. Eccentric training for injury prevention has been suggested as a means of decreasing the high prevalence of these injuries.
You're low-key right, LeBron. We don't really care about Justin's knee. We gotta focus on the muscles of the lower extremity. Throwing it back at you, man.
Standing, we have three groups of muscles in the lower extremity. Muscles that move the thigh, muscles that move the leg, and muscles that move the foot. Muscles that move the thigh are psoas major, ciliacus, gluteus maximus, gluteus medius, gluteus minimus, piriformis, pectineus, gracilis. There are two groups of muscles that move the leg. You have the hamstring group of muscles and the quadriceps femoris group. You also have the sartorius that helps move the leg. The hamstring muscles are the biceps femoris, subsumit tendinosus, and the semembranosus. The quadriceps muscles are the rectus femoris, vastus lateralis, vastus medialis. You then also have the muscles that help move the foot. You have the tibialis, anterior extensor digitorum longus gastrocnemius, soleus flexor digitorum longus, tibialis, posterius, fibularis, longus.
You know me, I'm the GOAT, so I got to tell you all about the origin and insertion of the muscles that move the leg. The origin of the sartorius is the anterior superior iliac spine, and it inserts on the medial surface of the tibia. The rectus femoris has origin of the anterior superior iliac spine and is interested in the patella. The origin of the vastus lateralis is the greater trochanter on the femur and is inserted on the patella. The vastus medialis has origin of the medial surface of the femur and is also inserted on the patella. The vastus intermedius origin and insertion is the anterior lateral surface of the femur and the patella. The origin of the biceps femoris is the ischial tuberosity and is inserted on the fibular head. The semitendinosus muscle has origin of the ischial tuberosity and insertion of the proximal medial surface of the tibia. The semembranosus also has origin of the ischial tuberosity and has insertion of the medial condyle of the tibia. Okay, that is all I got for you guys today. I hope you learned something while I talked about the lower extremity. Always remember Justin's tier, Mama Bear, My Hair, Lakers in 5.